Apologies for that. It seems we cannot get the sound of our very own Kamche Menza, but she is attending that particular convention. It is day one. We wanted to hear about what was happening during day one. You can see her clearly, but the sound lets us fix that, and then we get back to her. Now, elsewhere, Baringo County government has embarked on training the youth on digital innovation and digital economy in a bid to address the barriers to digital transformation. Baringo Governor Benjamin Cheboy says that the upcoming Baringo Investment Conference will provide an opportunity for the youth to network and explore solutions facing entrepreneurs in the digital sector.
Hindering the digital transformation of Kenya's economy. To address these, proper strategies are required to aid in overcoming those barriers and lead towards the digital transformation of the economy. Baringo County is set to roll out a training program for the youth during the Baringo Investment Conference. Cheboy says the county will partner with TVET centers to offer digital innovation training for 300 youth.
During the two-day event, 300 youth, about or over, will be trained both from the business environment and from our TVET institutions from within the county on various skills, including embracing digital innovation in business, digital information as a skill set for the workforce, data and cyber security, and the digital economy, among other key sectors.
Slated for this Thursday to Friday, Cheboy says the county will partner with TVET centers to offer digital innovation training for 300 youth.
To motivate them to come out with their ideas so that they should not say there is no employment. Employment is there. We want just to motivate their ideas and promote their ideas and show them how they can run business well. I want to tell the youth of this county that the idea they have is more important than the money they are looking for.
He says the move will help challenge the youth to overcome unemployment through innovation. Frederick Moki for Lunchtime News.
Now back to our very own Kamche Menza, who is currently attending a regional economic communities who have convened in Nairobi for dialogue on leveraging emerging technologies to improve healthcare delivery systems in Africa. Kamche, if you can hear me, good afternoon. What have you been able to gather on day one?
Well, apologies. Well, apologies for that technical hitch, but we shall continue with Dr. Rose Oronje, who will, of course, continue to, inform us on how these emerging technologies, she mentioned of drones, she mentioned of telemedicine and more other tools. And she's also saying that Africa is still facing a huge challenge in such kind of diseases. Earlier on, I had spoken to her and she said the population of African continent is only 18%, but in terms of diseases, we are actually at 25%. So what exactly can the African continent do? There are the emerging technologies which can be taken advantage of, but are we as African continent really taking advantage of that? Karibu, Dr. Rose. Maybe kindly, sorry for that technical hitch, continue on how we can leverage on the emerging technologies.
Thank you very much. So in terms of how we can leverage these emerging technologies, just to note that already countries are doing something. So we're not saying that countries are not doing anything. Like I said, Rwanda is already using drones to deliver blood to remote regions. Ghana is also doing the same, using drones to deliver medical products to various regions of the country, so that rural communities that have no access to health facilities are being reached. Now, what we are talking about in this meeting is about scaling, so that some of these pilots we are having in different countries can be scaled to benefit more people. There are mainly three things that countries need to do. One of them is to put in place policy and regulatory frameworks, because some of these technologies are new and the existing frameworks do not provide guidance for them on how they should be used. And so countries are here talking about what actions do they need to reform their policies, to put in place new regulatory frameworks for them to be able to harness these tools at scale. When we think about artificial intelligence tools, for instance, there's the big issue of privacy. People are saying all this information, you have it available, how is it being used? And yet it's information about my personal health, And so countries need to put in place regulatory frameworks to ensure that even as we harness these AI tools, we harness telemedicine, even as we use drones, that we are protecting privacy of people and respecting culture. The other things, apart from policies, the other thing is investing, putting in our own money. As we've just been discussing in the last session about the fact that a lot of these initiatives on the continent are being funded externally. Now that means we can't sustain this, which means when the donor funding ends, then these ideas end, these efforts end. And so we need to start putting in our own money. We need to start putting in these monies incrementally, the different governments to start investing in this incrementally over time so that we can own these efforts and ensure to sustain them over time. The final thing is just ensuring that we create awareness among the communities, because these technologies are benefiting communities. In some cases, we've had communities questioning, why are drones flying over our communities? Like, what are these? So just creating awareness among communities for them to see the value of these technologies, but also for them to learn about them. And actually, once they are clear on what they are, they can even hold their governments to account, asking them to invest in these technologies for them to be able to benefit them and improve lives on the continent.
Currently, the African continent has seen the emergence of the Marburg and the Mpox. From where you sit, how do you as a health expert, or what do you expect health experts to deal with such a health challenge?
So, Marburg and Mpox are, of course, ongoing, not pandemics, I think ongoing epidemics in the region. And part of what we are discussing in this session actually is how can we, as the regions, harness these technologies to enable real-time sharing of data? Because with these epidemics, these outbreaks, you really need to be able to share data across different countries real-time. And so some of the issues that have been discussed by leaders from the different countries is how they're using these technologies to enable real-time sharing of data so that we can contain the epidemics within specific regions. So that is important in terms of how do you harness these technologies, mobile phones, gathering of data and sharing it real time. How do you harness that to enable the efforts going on to contain the ongoing epidemics in the region? I think the other thing is really about, again, investments. In terms of how can the regions own some of this. The issue with outbreaks, the good thing with outbreaks, that often whenever they happen, a lot of development partners come in, to support, because then this poses a challenge across the borders. But the reality is that for us, we shouldn't wait for epidemics, for outbreaks. If we're investing ourselves, it means we are driving the tracking of different things changing within the communities, and we are able to prevent outbreaks than waiting for them to happen and then funders come in to help us.
Okay. Yeah. Thank you, Dr. Rose. But before I leave, allow me to engage. This is Karibu Sana. Karibu to Kenya. Just stand here and face the camera. Maybe from the regional, of course, from the regional issues that are affecting the region. We've had the aspect of the Kenyan aspect, but from the regional aspect, that is the African aspect. How is the situation? Is the situation that bad that we need now to leverage on the emerging technologies?
Number one, we first need to understand that we are in the fourth industrial revolution, and being in the fourth industrial revolution, knowledge will be leading us. And when we talk in terms of knowledge, not only simple education, so we focus mainly on research and experimental development. And also, on top of that, we have to add innovation. We are not preaching the linear model where saying if we invest in research, we have to have innovation, because innovation can still occur without research. So what is happening nowadays is that we need to catch up as Africa. So we don't need just being there, being the victim, saying that all the diseases are coming from Africa. We have a capability. We have the possibility. We have the natural endowment. So what we need to do is to make sure that all our countries still focus mainly on research to address societal problem. Health is most of the key aspect. When it comes to Human Development Index, we have life expectancy. It's linked to health. We have income. We have the issue of literacy. And for your information, we have 33 countries on the continent. Out of the 55, they are least developed countries. And we need to change that narrative to move to the middle-income countries. So it means that as we are the African Union, we have a vision known as Agenda 2063. And in that vision, we have to support based on our various sectoral aspects. So in the current 10-year implementation plan, we need to use our science, technology, and innovation strategy to change the narrative, focusing on emerging technologies and to address problems that we have in the field, in the sector of health. So on top of that as well, we are now in this nexus where we don't have only science, technology, and innovation on the one hand, but we need to add also health and put everything together. So we can no longer work in silo. So what we are doing today is to involve regional economic communities. There are 8 here with us. Some are represented virtually. So the intention is, in integrating the continent, we need to work with RECs, at least by the time they go to work with countries, because we have a collective responsibility to accelerate the implementation of what we are doing in terms of emerging technology. So that's what we are doing. And we believe, as we finish this meeting, that this is not the first time and the last time. We continue working with them and involving also other stakeholders. So the situation is not so bad, but we need to work together.
Again, from where you sit, have you tried and evaluate the countries, the countries in the African continent who have already adopted some of the emerging technologies, and maybe how far they have gone with, and what are the challenges they face in even trying to fully implement the ET?
Very excellent question. I'll be very brief on that. We have several emerging technology, but for your information, artificial intelligence is one of them. And recently, our head of state and government, especially through the African Union Special Technical Committee on infrastructure, they did adopt the artificial intelligence strategy. So what we have to do now to allow our countries to domesticate that strategy, or to align that continental strategy to their own national strategy. If they don't have, we have to support them, is our responsibility. And also regional economic community to do the same thing. We need to put that continental strategy in our regional one, and to also consider aspects related to ethics in the utilization of those emerging technology, as well as the governance of it, because we are also handling data.
Okay,
yeah.
Thank you so much.
Pleasure.
That was really informative, and that is something that, of course, different countries need to embrace and fully embed in their healthcare system. Issues that have come up there, you realize that there's the issue of finance, there's the issue of political goodwill, there's the issue of also sensitization to the public, there's also the issue of, scaling the whole system, and also there is the issue of trying to accept that there is new technology, and of course that is the technology that will help us get out of, let's say, poverty and also the diseases that are affecting most of the African countries. That is what is happening here, but I'll now hand it over back to you in studio, Abdi.
Thank you so much, Kamcha Menza, and of course you'll duly inform us in our subsequent bulletins on other measures that have been taken by the experts and the regional masters that have convened here in the capital to address those health issues within the continent. Elsewhere, conservationists and tourism stakeholders have launched ecotourism sustainable recovery initiatives aimed at promoting Malindi as a green and clean tourist destination. The move seeks to ensure beaches and towns are kept clean